Assalamualaikum warahmatullahi wabarakatuh. I am going to explain how PPSC interview is conducted, how you will introduce yourself, either you are a doctor or any other medical professional, and later we will discuss some important topics regarding MO and WMO interviews. Okay, the first thing you need to do is to prepare yourself. Get ready with all the important topics that we're going to discuss in a while. Get together your all the documents that they have mentioned on your interview call letter. Arrange your dress that you're gonna wear on the interview day, and it is important because your dress should be quite decent and appropriate on that day. The most important thing here is your mental relaxation, because even if you prepare everything so well but you become nervous and confused on that day, this could multiply your performance with zero. So please be confident upon yourself and your knowledge. Confidence and trust are the key to success. Either it is on you or Almighty. Just remember, अगर कोई चीज़ आपके लिए है, उसको कोई और नहीं ले जा सकता. The next point here is introduction. How you will introduce yourself. Let me make a thing clear here that introduction is different for everyone because everyone has his own information and his own style to introduce himself. Here I have written a skeleton of introduction that you can use to make your own introduction. Okay, the first thing you need to tell is your name, then your region where you belongs. Then if you feel something important about your family, you can add on, and it is completely optional. After that, you will give details of your schooling, from where you did your matriculation, then your intermediate, and then your graduation, and in which year. Then you will give your professional details, in which hospital you did your house job and in which departments. Then you can add your further working experience or any additional diplomas or achievements if you have made, or any research work. At the end, you will tell about your current job, where you are working, and in which department. So using these points in a descending order, you can make your introduction. One important thing that I would like to mention here is about language. कुछ लोगों का ख्याल है कि इंटरव्यू सिर्फ इंग्लिश में कंडक्ट होता है, जबकि ऐसा बिल्कुल भी नहीं है. डॉक्टर्स के इंटरव्यू में लैंग्वेज की कोई रिस्ट्रिक्शन नहीं होती. अगर आप इंग्लिश बोलने में कंफर्टेबल फील नहीं करते तो आप बिला झिझक उर्दू इस्तेमाल कर सकते हैं, और इसकी कोई नेगेटिव मार्किंग या कोई नेगेटिव इम्पैक्ट नहीं होता. आई हैव रिटन हाउ आई इंट्रोड्यूस माई सेल्फ. लेट्स प्रैक्टिस इट वंस. ओके, लेट्स स्टार्ट. माई नेम इज़ डॉक्टर डैश, डॉटर ऑफ और सन ऑफ डैश. I belongs to dash city or village. My mother is a dash housewife, doctor or teacher. My father is a dash. We are dash siblings 2, 3, 4 or 5. This is completely optional. My primary education is from dash school. My secondary education is from dash college. I have been graduated from dash medical school or university with a distinction in that in the year dash 2020. Then I gave my dash exams. After that, I started my house job at dash hospital, where I worked in the following departments. You can add your all the 4 departments where you work as a house officer. I started my first job at a dash hospital. For example, I started my first job at district headquarters Rawalpindi as a WMO, where I worked in the gynecology and medicine department. Currently, I am working as a WMO at a private hospital. Okay, so this was all about how you can introduce yourself. Now let's talk about how they start questioning to you in the interview. In the panel, there are 3 persons. One of them is bureaucrat and 2 are medical doctors. Any one of them can start questioning to you. Please remember, they always start from simple questions and then proceed toward complicated ones, or they may remain at simple ones. They mostly ask the questions from the areas or the fields in which you have been working. Secondly, most of the time they extract questions from your own answers. Let's talk about the important topics. First of all, important questions from the community medicine. What is EPI schedule? What is disaster and its management? What is ATT? What is DOT therapy? Give the name of communicable diseases or non-communicable diseases. What is multi-drug resistance tuberculosis? What are waterborne diseases? What is polio, measles or mumps? What is tetanus? How DHQ, BHU or RSC hospitals work, or what are the duties of MO at the DHQ or BHU? Difference between the primary, secondary and tertiary healthcare departments or hospitals. What is health? What is disease? एवरी क्वेश्चन कंटेन्स व्हाट इट मीन्स आपको ज़्यादा नहीं तो एटलीस्ट सबकी डेफिनेशंस का पता होना चाहिए। मोस्टली डेफिनेशंस ही आपका आंसर होती हैं। नाउ इम्पॉर्टेंट टॉपिक्स फ्रॉम मेडिसिन। मायोकार्डियल इन्फेक्शन, इसकी टाइप्स पूछी जा सकती हैं। स्टेमिंग एंड स्टेमिंग, ट्रीटमेंट इसका पूछा जा सकता है। मोस्टली यही पूछा जाता है वो बताएं जो आप करते हैं इमरजेंसी में। तो आपने याद रखना है आप इमरजेंसी में एमआई को किस तरह ट्रीट करते हैं। एसके के बारे में पूछा जा सकता है। व्हाट इज़ एसके, इंडिकेशंस, कॉन्ट्राइंडिकेशंस, प्रिपरेशन ऑफ एसके। Differential diagnosis of chest pain, like it can be pruritic or cardiogenic or muscular. And if you have done your house job in cardiology, they may ask you questions like heart failure, heart block, arrhythmias, or rheumatic fever. And the next important question asked in medicine is about hypertension, types of hypertension, treatment of hypertension, stages of hypertension. Then a question about DVT, pulmonary embolism. And if some pulmonologist is sitting there, they may ask you what is tuberculosis, definition of pneumonia, pleural effusion, definition of pneumothorax, what is emphysema, what are COPDs, what is asthma. Management of diarrhea, very important. What is hepatitis? What are IBDs, Crohn's disease or ulcerative colitis? Diabetes mellitus, types of diabetes, complications of diabetes, treatment of diabetes, insulin and its types. Question about the diabetic ketoacidosis and honk are very common. What is goiter? They may ask you about headache if you start feeling headache there. So you must know the types of headache, treatment of migraine, definition of meningitis or treatment of meningitis, types of stroke, management of stroke, especially in the emergency, definition of anxiety, definition of depression and their treatment, or difference between the anxiety or depression. This can be asked mostly if you have done your house job in neurology. इतने सारे टॉपिक्स देख के आपने डरना नहीं है। अगर आपके पास टाइम कम है तो आप वही टॉपिक्स रीड करें जिनमें आपने हाउस जॉब की है या जिसमें आपका एक्सपीरियंस है, क्योंकि मोस्टली वो उसी में से आपसे क्वेश्चन पूछते हैं और मैंने सिस्टेमिकली क्वेश्चंस को अरेंज किया हुआ है। नाउ टॉपिक्स फ्रॉम यूरोलॉजी, यू शुड नो द ट्रीटमेंट ऑफ यूटीआई. Then they can ask you what is AKI, acute kidney injury, or what is CKD, chronic kidney disease, what is DCLD and their management. Now from infectious disease they can ask about malaria, dengue fever, typhoid fever, tetanus. इन सब की आपको डेफिनेशन, क्लिनिकल पिक्चर और इनकी ट्रीटमेंट पता होनी चाहिए। एड्स के बारे में, HIV के बारे में कुछ हद तक आपको पता होना चाहिए। टाइप्स ऑफ एनीमिया, treatment of anemia, blood transfusion guidelines. Now question from gynecology. Types of vaginal discharge, treatment, stages of labor, types of abortion, what is miscarriage, what is ectopic pregnancy, management of PPH, definitions about placenta previa, what is placenta accreta, abruptio placenta, management of hypertension in pregnancy, safe drugs in pregnancy, what is eclampsia or pre-eclampsia, or difference between eclampsia or pre-eclampsia and their management. From surgery they can ask you about appendicitis, cholecystitis, hemorrhoids, intestinal obstruction, and the important cases that used to deal in the surgery department. Other important topics are shock, that is most important topic, types of shock, management of shock, burn, what is CPR, what is BLS, snake bite management, management of drowning, management of poisoning. Usually they ask kala pathar poisoning, and treatment of scabies or acne. अगेन मैं कहूँगी इतने ज़्यादा क्वेश्चंस देख के आपने ये नहीं समझना कि आप कोई एग्ज़ाम या वाइवा देने जा रहे हैं। ये एक इंटरव्यू है और इंटरव्यू में नॉलेज से ज़्यादा आपका एटीट्यूड और आपकी पर्सनैलिटी को असेस किया जाता है। सो प्लीज़ बी कॉन्फिडेंट एंड गो विथ होप। इंशाल्लाह वही होगा जो आपके हक़ में बेहतर होगा। बेस्ट ऑफ लक।